When I was young, we have a simple life. My father was a farmer, and my mom had a little store. My mom always told us the value of studying very well, and being caring and compassionate. So I graduated actually in 1980, Bachelor of Science in Nursing. The following year, I immigrated to the United States. My eldest daughter, Kathleen, was born in 1987. Alex was born in 2008. I remember being in the labor and delivery room. At that time, we already know that he will be born with Down syndrome. The first year of his life, all the tests that were coming back were great and that he's going to be okay. He's growing up to be a wonderful, caring, typical child, typical boy. So my wife, my daughter, and I decided to give back. We just started with $100 to send one child to school. And we did not expect that this $100 will now grow into this foundation we call Alexander Begonia Foundation.
When I was maybe 12 years old, I was in the Philippines for the first time. So I was wondering, what do they do for fun? And he explained that they would just play with a little ball and run around. And that was life. If it rained, they just played in the rain and the mud. It was very simple. So I didn't really understand this. So I asked my dad as we were walking, I said, how come no one here has a playground? Meanwhile, everyone back home in the US seems to have a playground in the backyard.
She asked me, how much does it cost to build a playground? I give her a number, and then she says,
you know what, can I just try to save my babysitting money? I was making very little money at the time.
I had the opportunity to help others. That's 16 years later. We now have 26 playground equipment, and will be 6 more being built in October for elementary schools. That's how that playground equipment came about. I started working at North Shore University Hospital. I was hired as one of the nursing supervisors. That was 31 years ago. Somebody told me about the North Shore LJ Health System Global Health Initiative. And at first, I was hesitant to apply for it because of the fact that we don't ask for donation. But one of the head of the Global Health Initiative encouraged me to just put the application anyway, and I did. I was given a grant to build more playgrounds and also help with the feeding programs and medical missions. With that, we're able to do blood pressure screening for the medical missions, to give out medications, to multivitamins to the adults, and we're looking into giving out multivitamins also for the children. Because of the limited funding of the foundation, we cannot expand that. It breaks my heart that the last time we did this medical mission, there were over 30 people that were there. And if those patients would have been in the United States, I can assure you that half of them would have been admitted to the hospital.
In the future, I would really like to expand it in the Philippines and other provinces, but also one day I'd like to expand it throughout the world. Alex is the light of my life. He's such an inspiration in my life, and I'm really glad that he's there. I love helping others and paying it forward. One day I just really hope that the rest of the world can be touched by the foundation in some way.
I'm hoping that we can continue what we do and expand on that. My daughter is already gearing to continue with the foundation.
There's a lot of terrible things that happen in this world, so I just feel like there's a way to make it better.